for foreign graduate nurses, if you are looking to um, fulfill your American dream, come over here to the United States, but you don't have a budget to take your NCLEX. We are offering scholarship programs under the Connetics USA. They flashed the link earlier to apply. It's conneticsusa.com/application, or you can also message me in Facebook or Instagram. I'll give you my handle later. So, like we said earlier, Nclex examination is an RN licensure examination for the United States of America, Canada, and in Australia. They also require foreign graduate nurses to take the Nclex. Nclex is a very difficult exam. The questions are very tough. It's high level or high order of thinking types of questions. And it's computer adaptive, which means it adapts to your ability to answer the questions. The minimum items that you can have is 75 and the maximum is 145. And next year on April 2023, they're going to update the test bank and we're now going to get more difficult questions. We call the new or the next generation NCLEX questions. We'll talk about that in another meeting. But today I'd like to focus on prioritization types of questions. If you have been preparing for NCLEX or you want to prepare for NCLEX, you want to know about prioritization, there will be plenty of questions about prioritization in the NCLEX. So this will be a quick lecture. I'll be flashing questions. You'll help me answer the questions. All right. So please stay on Facebook right now. I've also shared this link in my Facebook account and in the groups that I am in. If you are here right now, can you please message in the comments box your location and what time is it right now? That way I know where you guys are coming from. I know we've seen one from Germany. I've seen one from our student from Nigeria, and I've seen some people from the Philippines. Don't leave yet because I have some question and answers that we will be doing today. You're going to help me answer the questions. I'm going to give you tips and then we'll apply that to the questions that I'm going to flash on the screen. Yeah, there you go. We have Sarah from the Philippines. We have Lenny from Saudi Arabia. It's 5 p.m. there. Good afternoon. Oh, we have Ariana from St. Vincent and Grenadines. Wow. And Adrian from Philippines. We have Judith from Qatar. Mary Fur from Saudi Arabia as well. We have a lot more people from Philippines. Melody from Singapore and Lou from Qatar. Wow, we're all over the world, guys. Thank you so much. Please stay with me, okay? Even if you're already an NCLEX passer or you haven't even applied for NCLEX, don't go. I want you to participate in this review. This will be very short. I only have 10 questions, but these are very difficult questions. It's prioritization. So help me answer these questions. All right. So what I'm going to do is I'm going to discuss little tips and then we'll apply that to questions. When I flash the questions, I'll give you about 30 seconds to 1 minute to type in the letter of your answer in the chat box. All right. Are we okay with that? You're going to type in your answers in the chat box. And then when I get enough answers, I'll explain the answer after that. All right. We have people from Nigeria, from Riyadh, Saudi Arabia, from UAE, and from different parts of the Philippines. Thank you guys for joining. You guys are ready? All right. Let's go to the next part of the slide. All right. Oh, we have one student that said, Stephanie, she said she completed master's degree in nursing. Congratulations. In Brazil. Wow. And 7 years of experience in Haiti. All right. Thank you for joining, Stephanie. Thank you for sharing your life story. I love people that like to advance in their careers as nurses. You know, that's what I like about nurses. We keep going up. We keep going up. This is what this show is called. You know, it's onwards and upwards. So yes, go for advanced graduate degrees. I've earned my master's degree about 6-7 years ago, and now I'm finishing my doctorate. So keep going, keep going. And congratulations, Stephanie, for your achievements. We have one from Jamaica as well. We're all over the world. And thank you guys for joining. Now let's go to the next slide. Let's talk about prioritization. There will be plenty of prioritization questions in NCLEX. These are high-level questions. in Bloom's taxonomy in education, these are application or analysis or evaluation levels of questions, which means you need a good background of what the concepts are talking about. You should have mastery of concepts before you're able to answer prioritization questions. These are questions that require critical thinking and knowledge about many different nursing and medical sciences. So, before you answer prioritizations or before you even get to answer prioritization questions correctly, your foundation of the nursing sciences or the knowledge base is important, right? So, when I conduct my classes in ASPIRERN, just like what Raymond and Sindel had to go through in my classes, in our classes in Aspire RN, we usually put prioritization lectures towards the end. We want students to build their concepts first. I've been doing the review for almost 15 years, and what I've learned is if I put prioritization at the beginning and students don't have knowledge about or the knowledge base about basic sciences like maternity nursing or anatomy and physiology or basic pharmacology, it will be difficult to answer prioritization. So what I want you to do if you're reviewing for Nclex is build your foundation first, which means review the main concepts. All right. You have to have the mastery of topics such as pathophysiology. You should be able to understand diseases because without pathophysiology, you would not know what would be the priority or complications. You have to have an understanding of pharmacology. You have to have a broad understanding of your assessments. So assessments are very important because you should be able to determine what is normal or expected for a certain condition and what is abnormal or sudden changes for certain conditions, right? And of course, you also have to know your normal values, normal vital signs, and every number that you need to remember for your exams. In NCLEX, they do not tell you the lab values. So see, that's the difference between NCLEX and my nurse practitioner board. In the nurse practitioner board, they'd at least give you range for lab values. What is normal, what is abnormal. In NCLEX, they want you to memorize the laboratory values. So if it gives you a question that says, oh, the patient's PTT is now about 105. Are we going to continue heparin or not? So without knowledge about that, it will be hard to answer the question. So for prioritization, should have foundation and mastery of the core concepts before you're able to answer prioritizations questions um, uh, well. Right now, this is my tip number one, and basically every nurse know this. Right, always remember to prioritize your ABCD. Right, ABCD. ABCD is a mnemonic that we lifted from the trauma nursing core competency or TNCC. It basically says airway, breathing, circulation, and disability or neurologic disability, otherwise known as LOC or level of consciousness changes or mentation changes, orientation changes, neurologic changes, right? So when you're answering prioritization questions, always look for, is there an airway disturbance? Is there a breathing problem? Is there a circulatory problem? Is the patient on shock? Is the blood pressure low? Is the patient pale or cyanotic? Is there LOC changes, which means is the patient confused? Is the patient disoriented? Is the patient stuporous? Is the patient unresponsive? Those will definitely be your priority. Of course, our priority is always ABC, airway, breathing, circulation. If you don't find any problems with ABC issues, then you go for LOC or orientation changes, all right, or neurologic changes, all right? So, except when the question is about CPR, if it's about basic life support or the patient's unresponsive without a pulse, then you start CPR, all right? That's going to be for another lecture. When I do my prioritization and emergency nursing lecture, by the way, I did not tell everybody, I'm an emergency nurse, so my background in nursing is emergency medicine. So I have a huge, good background about emergency. So I love to teach prioritization and triaging and emergency nursing, basically. So if it's talking about, CPR, you start compressions first. If it's talking about trauma and there's an injury, your priority is stopping hemorrhage or controlling hemorrhage first. Other than those two, you always prioritize airway, then breathing, then circulation, then LOC, changes, or disability. All right. So let's see this question. So that's our first tip. All right. We have more people coming in. We have now people from Kuwait and still a nursing student. One student said he was my student from years ago. All right. I've been teaching since 2009. All right. So if you count it, how many years are those? 13 or 14 years. All right. Anyway, let's go to the next slide and let's see your answers. All right. Let me read it for you. Which of the following client in the unit will require immediate attention of the nurse? Is it letter A, CHF client or congestive heart failure with cough and difficulty breathing? Letter B, ESRD, end stage renal disease with increasing pedal edema. Letter C, acute pancreatitis with muscle jerking. Letter D, diabetes mellitus patients with ketoacidosis with glucose of 200. All right. So what's your answer here? A, B, C, or D? Can I see your answers? A, B, C, or D? All right. Um, this is the priority questions. All right. I'll help you eliminate those that we don't prioritize or will be last priority. Of course, all of these patients have acute problems, which means all of them have issues that we need to treat. But when you're asking about priority, which one would we need to see first or treat first? Let me remove letter D because even if it's a DKA, the sugar is 200. I'm not concerned unless it's more than 300 at the very least. But of course, we still need to treat DKA, but not a priority right now. Let's eliminate letter D. What is your answer? A, B, or C? All right, let me remove letter B. All right, ESRD patients not a priority right now because the pedal edema is actually an expected symptom of ESRD. There's no emergency there. The patient's not going to die with that. All right, it's already expected. All right. A or C? The answer is, I see a lot of letter A's. Let's see if the answer is letter A. Actually, the answer is letter A. Why? Remember the tip. It's A, B, C, D. Prioritize airway and breathing patients first. All right. So answer is letter A. CHF client with cough and difficulty breathing because obviously this patient has an airway and breathing issues. All right. CHF patients are fluid overload patients. They have a lot of pulmonary effusions or pulmonary congestion because of the backup of your blood, to the pulmonary spaces. This congests them and decreases their oxygenation and makes them have respiratory distress, which can be very dangerous because they can have hypoxia and hypoxemia. So answer is letter A. So you see, you have to have a good background about pathophysiology in your assessments to be able to answer this. So answer is letter A. To those who answered letter A, you got it correctly. Right? How about number 2? Let's see this. Which of the following patients should the nurse prioritize? Is it A, 31-year-old female with appendectomy 2 days ago and experiences pain, 8 out of 10. 20-year-old male patient with type 1 diabetes, restless and agitated. 49-year-old with TERP who has difficulty voiding and experiences burning. Or D, 39-year-old schizoaffective patient develops insomnia and constipation. Which would you prioritize? Can I remove letter D? All right, the schizoaffective patient, because we don't prioritize psych patients unless they're suicidal. The only time you prioritize a psychiatric patient is if they're actively suicidal because they can hurt themselves. All right. And that will be very dangerous. Your priority, your safety. Let's remove letter D. Not a priority right now. A, B, or C. All right. I see a lot of answers. Very good. All right. Keep it coming. I want to see more answers. What are your answers, guys? Letter A is not a priority. If you have an appendectomy, you would have pain. All right. You just need to give pain medicine as a nurse, so you don't have to worry about that. All right. B or C, the answer is letter B. Very good. We've applied the ABCD rule. Letter D is disability or LOC changes. If you have a type 1 diabetes patient and he is having restlessness or agitation, you would think about DKA. You would think about sugar is pretty high and it's causing imbalance in the fluids or in electrolytes. You know, when the sugar is too high, the sugar pulls out the water from the brain and puts it into the vascular spaces. Patient starts to pee a lot. But what happens to the brain? There will be imbalance of fluid. The fluid movement or shifting causes a lot of confusion. This we can see in patients with DKA, which is also more common in patients with type 1 diabetes. All right. So answer is letter B. All right. That is our priority. Your next action should be to check the sugar level and to report to the physician. All right. Answer is letter B. Very good, guys. All right. Number 3, triage nurse must decide which of the following children should be examined first by the pediatrician. Which child would the triage nurse prioritize? I'll let you guys read it, okay? Let me just message the moderator real quick. All right. So is it letter A, 7-month-old, fell into a sofa? Letter B, 4-year-old, bicycle, fell off bicycle with bleeding, lacerations. Letter C, LTB patient or laryngotracheobronchitis, wheezing and auscultation. Or letter D, a 6-year-old child experiencing asthma has diminished wheezing and is very, I couldn't see it, and is very irritable. What is your answer? All right. I see 2 answers here. I see C and D. All right. Okay. I'll remove other options for you to make it easier. Letter A is not a priority because the only thing that it said is the patient fell and hit the head. We don't have other symptoms that need to be prioritized. Letter A is removed. Letter B, all right, bleeding lacerations are not a priority. They're lower priority unless it's arterial bleeding and the patient's developing shock. Letter B is not a problem. The sutures can wait. We can pack it with dressings. We have what we call in the ER quick clots. It's a combat gauze that they use in military that has clotting factors in it. We put it on the wound and wrap it up, and the bleeding stops in 3 to 5 minutes. All right, that's our priority. C or D, both of them have airway problems. This is the trick with Nclex because you can have 2 airway problems, you can have 2 breathing problems. Which one will have complications first? In short, which one will die first? C or D? C or D? All right, letter C. While there is a wheezing, you have to remember letter C has an expected symptom. We know that if they have LTB, laryngotracheobronchitis, they would have wheezing, and that's fine. All right, 30 breathing per minute is also expected because they're having trouble with breathing. The priority is letter D. Why? Let me flash my slide. Why? Because the child is in asthma. If you see the word diminished breath sound or diminished wheezing, that means total or complete obstruction of the airway. Total or complete obstruction of the airway. And you see, irritability is an LOC changes. It means hypoxia of the brain. Answer is D. The patient is having status asthmaticus at this point. This is an emergency. We need to give epi shot or start the bronchodilator treatments right away. This can be very fatal. A lot of asthma kids have died because of status asthmaticus, where there is total occlusion. The airway is now completely blocked because of inflammation, and there's no air that will move, right? The air doesn't move, there's no breath sounds. This is very dangerous for asthma. You see the word diminished breath sound or diminished wheezing, that's an airway compromise. That is a priority. All right, so everyone who answered letter D got this question correctly. Question number 4. All right, after receiving change of shift report at 7 a.m., which of these patients will you assess first? A, migraine headache patient with retching. Retching means vomiting. All right, letter B, 45-year-old with craniotomy, needs preoperative teaching. Letter C, 59 years old, Parkinson's, needs swallowing assessment. Or letter D, multiple sclerosis, oral temp of 101.8, and flank pain. Looks like a lot of them have acute issues, right? A lot of them have acute issues. Let's remove letter B for a minute because craniotomy that needs pre-op teaching is not my priority. That's a very stable patient. And of course, pre-op nurses can also do pre-op teaching. That's not my priority. Remove letter B, all right? What is your answer? I see mixed answers here. What is your answer? Letter A, let's remove letter A. Nobody said letter A. Migraine with vomiting is very common. It's expected. There's no danger there. You just stop the migraine headache, give pain medicine, give Reglan to stop the vomiting, period. We're done. So that's not a priority. That patient can wait. You just arrived in the unit and you got report from the night shift nurse. Now who do you need to see first? C or D? C or D? Answer is letter. Remember your tip is airway, breathing, circulation, and disability. Which among these two patients will have airway compromise? I would answer letter C. You know why? You know why? Parkinson's patients have difficulty swallowing, and the breakfast tray is about to be served. They usually come in at 7 or 8 a.m. in the hospitals, guys. And those patients, when you put the tray, they'll start eating, right? You need to assess swallowing reflexes first, swallowing ability. If not, patient chokes, patient have aspiration pneumonia, you're now at risk for legal liability because family comes in, sees the patient choking, you're starting your Heimlich maneuver, and now you get sued. All right, that's a liability for you. Answers letter C because of airway issue. All right, you have to do letter C first, and then you go to letter D. Patients probably having UTI. UTI is not a priority unless it's sepsis. We don't see signs of sepsis here except temperature. All right, answers letter C because of airway issue. All right, so very tricky question. All right, answers letter C. All right, you have to assess airway, prioritize airway first. Now, second tip, we only have 3 tips for today. I'm already on number 2, and we have 10 questions. We're already in question number 4. Tip number 2 is prioritize unstable patients. When I say unstable patients, what do they mean? New admits. Whenever you admit patients the first time, they are unstable. Why are they considered unstable? Because you need to do your nursing assessments and find your priority problems. Worsening symptoms or vital signs. For example, a patient has a blood pressure of 140/90 an hour ago. Right now, when you recheck the blood pressure, it's already 80/30. That's unstable, correct? Or earlier, the patient has a heart rate of 95. When you recheck, the heart rate is now 140. That's unstable, all right? Complications. For example, a patient had a post-open abdominal exploratory procedure, all right, for peritonitis, and is now having distended abdomen, decreased abdominal bowel sounds, and blood pressure of 90/40. So those are complications. The patient might be bleeding inside. Unexpected or sudden changes, right? Patient was alert, awake an hour ago. When you came in, the patient's unresponsive. The patient's not breathing. The patient is blue, all right? Unexpected or sudden changes. Treatments that need to be started, all right? Stat, for example, the patient has an order for bronchodilator nebulizer, all right? But it hasn't been started yet. That is an unstable patient, all right? So when you see all of these criteria being met, the patient is unstable. You always prioritize an unstable patient versus patients that are stable, all right? So let's see. Let's apply this tip number 2 to questions, all right? Let's check question number 5. A few more minutes to wrap up this meeting, okay? Question number 5. Shortly after arriving for the evening shift, the triage nurse evaluates several clients who came into the ER or ED. Which client should receive the highest priority? I'll let you answer this, guys. A middle-aged man, diaphoretic, severe chest pain radiating to the jaw. Letter B, elderly, complaining of loss of appetite. Letter B is stable. That's not my priority. Letter C, basketball player limping and complaining of pain and swelling in the right ankle. That's stable. Nobody dies from a right ankle fracture or injury or muscle pains. Letter D, sugar of 225, complaining of thirst. That's a symptom of diabetes. That's expected. That's not worsening symptom. That's not worsening symptom at all. That's not a complication. That is expected. Letter D is also stable. Answers letter A. What are we thinking here? Patients probably having what? A, heart attack, myocardial infarction. That is our priority. Very good, guys. Easy question. Number 6. Which client, thank you guys, thank you. Let's move on to the next one. Which client would be the RN's priority in an acute care situation? Client with diabetes, glucose of 180. Client 3 days post-op with left calf pain. A newly admitted client with chest pain, or client complaining of pain following surgery from hip pinning. Apply the tip that I said. What is your priority? A, B, C, or D? I'll give you 30 seconds to answer this question. Very good. I'm seeing a lot of participants answering letter C. All right, so I guess we know the answer already. Letter C. This is easy for you because I already told you new admits are unstable. You need to do your assessments. Yes, I know letter B might have an acute issue too. Yes, I know letter D might have an acute issue, but they're not my priority. I'll prioritize letter C. Very good, guys. Very good. We're learning very well. Thank you. All right. Good job, guys. Good job. How about this question? Can you answer this for me? Which of the following patients would you prioritize first? All right. Lumbar puncture for letter A. Pain is 3 out of 10. B, pulseless tachycardia for post-MI. C, 14-year-old sitting at the edge of the bed with cervical implant. I don't think a patient with cervical implant should be sitting on the side of the bed. So there's that. Letter D, 17-year-old anorexia with a sodium of 134. It's a little low. Normal's at 135, so that's not my priority. What's your answer, guys? Applying your tip number 2, which is prioritize unstable patients. Remember, unstable has sudden or unexpected changes. Unexpected is letter B, right? We're having complications here. The patient's now having VTACs, right? And that is fatal. You have to start CPR right away. Answer is letter B. Good job, guys. Good job. Very well. All right, let's go to the last and final tip. Thank you. Thank you. When you cannot use A, B, C, D priority tip, when you cannot use unstable priority tip, you now use triage. Prioritize using triage principles, all right? So we use triage a lot in the ER, all right? There are 2 types of triaging that you need to know when you are in the hospital, or when you're taking your Nclex, I'm sorry. 2 types. The regular triage, or we call it hospital triage, daily triage, routine triage. We always take care of dead or dying patients first. When you're in the hospital and you're working in the med-surg floor and you have 7 patients, hopefully not, because that's a lot. We have 5 or 6 patients med-surg. In the ER, we have 4, right? And you see 1 patient is dead or dying or unresponsive, unless it's DNR, that will be your priority. All right. Your priority in the hospitals are always dead or dying patients first. No matter what happens, your priority for regular triaging is the dead or dying patients first. Now, during disaster, the resources are scarce, which means you don't have a lot of resources. There could be 100 patients that are affected, but there's only like 10 nurses, right? Or there could be a blast in a stadium, right? There's 500 people affected, but there's only 3 ERs in this city, right? And all the ERs are now flooded with 80 patients each when they can only handle 20. So in disaster, because of the scarcity of resources, we cannot take care of dead patients first, all right? We do severely injured, but can live first. So they can live, they're severely injured. They probably have pneumothoraxes, or they probably have open chest wounds or open femoral fractures, or they can have bleeding everywhere, but they will live, all right? So you do not care of the dead or dying patients first. You take care of patients that are injured but can live, all right? But have the ability to live, or have the chance to live. So to cut it short, I'm going to use colors because I think you guys are familiar with triaging colors. We have black, the dead or dying. I like to discuss this further when I teach emergency medicine, and I do that in my class in ASPIRERN. So if you guys are interested, I'll let you know about the program later. Black, the dead or dying. The red are the severely injured but has the ability to leave if treated within 30 minutes. Yellows are the injured but stable, which means their vital signs are stable, but they're injured. Yes, they could have fractures, but they're stable, right? They have many lacerations. The greens are what we call walking wounded. They might be wounded with a small laceration or a bruise on their face or head, but they're walking. They have the ability to walk, which means they're alert, oriented, stable vital signs, ambulatory. They are not a priority. So in the hospital, you take care of black first, the dead or dying patients, followed by red, followed by yellow, followed by green. This is the ENA principle. We're using the Emergency Nurses Association principle here, or principles of triaging. So you take care of black. In disaster, it's different. We take care of red first, then yellow, then green, last is black. A lot of people get confused. They take care of green patients first, the green ones, the walking wounded. No, we don't do that. It's called reverse triaging, and we only use it in very few situations, such as during a fire in the hospital or in military operations. We don't use it here in the hospital or disaster triaging. Again, for hospital, you do blue, black, red, yellow, green. Black, red, yellow, green. In disaster, we do red, yellow, green, last is black. So you prioritize reds, the severely injured but can live. Severely injured but can live. All right. Now let's go to question number 8. All right. Question number 8. Let's go answer this question. You are practicing annual disaster drill. According to disaster triage, which of the following clients should be cared last? So you look for who is the last: red, yellow, green, black. Which one has the black triage? Come on, give the answer to me. I'll give you 30 seconds to process this. What's your answer? Hmm? I see mixed responses. I love it when we have mixed responses because that means I can properly explain it. All right. I love prioritization. A lot of nurses always get confused. So you see, this is high level of high order of questions, or high level thinking, critical thinking. This is application of what you've just learned. So let me tell you this, okay? I'm gonna give them colors, so we can use colors. Remember, black, red, yellow, green, right? For disaster, last is black. Letter A, I'll give letter A red because it's open tension pneumothorax. It leads to lung collapse. Letter B, I'll give letter B red because it's protruding fractures. We're talking about osteomyelitis and sepsis here, and of course, bleeding. Letter C, smoke inhalation injuries, airway compromise. It's also letter red. I'm sorry, color red, right? And letter D, listen, if your burn injury is more than 20% for adults, you're automatically red. For kids, more than 10%, and for geriatric, more than 10% is automatically red. All right, because this can lead to fluid electrical imbalance. Patients with burns will lead to shock. More than 40% of burn injuries automatically black. All right, they are more likely to die in the next 5 to 10 minutes. 70% burn, full thickness is third degree burn, is very fatal. I don't know if you guys have seen someone with third degree burn 70%. I don't know if you've seen someone like this. This patient is literally burnt. You probably could see muscles and bones at this point. That is black. If this is the disaster, my last priority is letter D, because this patient's about to die. I don't want to spend my resources and use it and not be able to treat the other patients. All right. Answer is letter D. So you see what I told you earlier at the beginning of the lecture. You have to have a good background with pathophysiology and assessments in order to answer this question. That's why prioritization is always taught last, right? In my ASPIRERN program, my prioritization lectures always lasts, all right? I want you to master your pathophysiology, your medical, surgical, nursing disorders first, your maternity, your obstetric, your geriatrics, your pediatrics, all of those concepts before you go to prioritization, because otherwise you're not going to be able to answer this correctly. Answers letter D, and I've explained why. All right. Answers letter D. All right. That's black triage. That's the last patient to be cared for. All right. Number 9. We're down to the last 2 questions. During disaster drill, which client should the nurse prioritize? The question earlier was who to care last, right? Right now, the question is who to care first, right? Who's your priority? Very good. I'm sorry. Let me just interrupt you guys real quick. The student responded from the last question earlier that I didn't read the last word. So you see, it's also very tricky because if you don't read the questions carefully, you do not get the right answer. And Nclex can be very tricky. All right. Now the question is, who will you prioritize first? First, all right. Remember, what is our priority for disaster? It's red, followed by yellow, green, last is black, right? Letter, I think we all have the same answer. Letter A is black, right? All right. I'm sorry. Hold on, guys. Hold on. Okay. Letter B and letter C are not priority. Answer here is letter D. I'm sorry. I did it last night, 12 midnight. So my highlighting is incorrect. Answer is letter D because it's chest injury and the patient is restless. Let me correct this slide, okay? Answer is letter D, not B, all right? Letter B, if you look at it, open fracture on the right arm and chest, incision with pain on inspiration, not a priority. That patient can wait. My answer is D because it's chest injury and the patient is restless. If it's chest injury, we're thinking about pneumothorax, and that can lead to lung collapse. Answer here is letter D. You also have another determinant here. Restlessness is an LOC change, which means hypoxia. Let me correct this slide. The answer is letter D. I highlighted the answer incorrectly last night, okay, when I did this. Answer is letter D. Letter D, client with chest injury and already restless, all right? Number 9 is letter D. Because of the chest injury, that's airway breathing circulation problem, and restlessness is LOC changes. So in disaster, that is our priority. The last is letter A, all right? Now, this question for number 10, you have to list into order. I want you to prioritize them by order, all right? You have to list down. There's no one answer. Your answer is 4, but you have to put them into order, okay? Your answer is 4 in order. What letter comes in first? What's next? What's the third? What's the fourth? So there are 4 patients in triage when you're in the ED. If you want to be an emergency nurse, this will be your everyday work in your life, right? This is what we do every day in ER. Do you prioritize an ambulatory days, 25-year-old male with bandaged head wound, irritable infant with fever, 35-year-old with a twisted ankle, pedal pulse, and no deformity, or 50-year-old with abdominal pain and vomiting? List into order, guys. I'll give you a few more minutes. I'll give you a minute to answer this. We have few responses here. I love it. We have different answers. I love it. I love it when we have different answers. That makes me like fires me up to explain it really good. All right. All right. Let me see your opinions. What is your answer here? And then I'll tell you my answer. We have varying answers, but I think we got the first priority correctly. Our priority is letter B. I think most of you all got letter B correctly. That's the first one. Letter B is our priority. Why? What are you thinking about this? What's your pathophysiology knowledge telling you about letter B? What is that? That is meningitis, all right? This can lead to seizures and neurologic compromise to kids. And of course, when you have neurologic compromise, you can also have breathing compromise or ABCD problems. So letter B is number 1. What is number 2? What is number 2? Letter Letter A, ambulatory but dazed. You see, the word dazed means confused. If you have a head injury and you're confused, you might have a what? Head bleed. That's my first thinking. If I'm assessing you, I need to get a CAT scan stat to make sure it's not a bleed, it's not a skull fracture, and it doesn't need a trauma management. So letter A is number two, followed by letter D, and then last is letter C. All right. So answer is 2, 1, 4, 3, or B, A, D, C. All right, good job. All right, what's your scores? Can I see your scores? Out of 10, how many correct answers did you get? Your passing score should be at least 7, but let me see your answers. Don't worry if you got 3 or 4 or 5. All right, put it in and let me see your answers. Don't worry. If you got 3, 4, or 5, you remember what Sindel, one of the students, said earlier. It's okay to make mistakes. In fact, I always tell this to students. It's okay to make mistakes during the review program because that's how you learn. You make mistakes now, which means you're not going to make mistakes again during the Nclex. Do not be scared to admit, sir, I only got 30%. I'd love for you to get 30% so I can teach you, right? Because if in the Nclex you get confused and you don't understand why you're wrong, that will be a fatal problem for you. I want you to make mistakes now so I can teach you better. All right. And good job. All right. A lot of you guys got 7, 9 over 10, 6, 9 over 10. Very good. These are a little easier questions because I feel like if I threw very hard questions in, it will take me a while to explain them. But you see, you get an overview about prioritization. All right. So this will end my lecture. I've got one more slide to show. Like I said, Connetics has a scholarship program for global nurses, for foreign graduate nurses outside United States. If you're from Canada, from Mexico, from Europe, from Africa, and from Asia, you can log on to connetixusa.com/application and you can file your application there. And if you meet the criteria and the qualifications, you can get scholarship from Connetics. Other than that, if you already have an agency that's working with you, ASPIRERN is also offering programs. We do have 3 different programs. SurePass Starter is good for 3 months. SurePass Pro is good for 1 year, and SurePass Plus is also good for 1 year unlimited. The other one, the SurePass Plus, has an included UWorld with faculty access for me and my faculty member, Sir Gian, so we can see your performance and give you personal mentorship. We give personal mentorships to our students. And you can follow me on Instagram at Dr. Nurse Paul or at ASPIRERN. All right. So this program has been hosted by Connetics and ASPIRERN. I'd like to thank Connetics USA for inviting me to Onwards and Upwards. I believe Connetics has more shows that they do regularly, routinely. So please follow their Facebook page. There's a lot of shows that we did in the past giving you tips of how to survive life in America as a migrant nurse. What are the tips that we can give as migrant nurses? There's tons of videos that we did over the years. So please follow Connetics. We do this often. And if you have questions, you can also message me or message Connetics. All right. We'll be able to help you achieve your American dream. All right. Thank you guys for joining me today. Thank you, Tanya. Thank you, Sindel. Thank you, Raymond. And to everyone all around the world, thank you for staying with us for this show. And I'd love to hear from you. We'd love to hear from you. Please send your messages through our direct messages or here in the comments below. We'll be reading it. We'll be trying to answer questions throughout the day. All right. God bless you all. And I hope to hear from you. Bye.